So let me begin by introducing Dr. Mayur Narayan. Mayur Narayan is an attending trauma surgeon at Weill Cornell Medical Center. He has both an MBA and an MPH from Johns Hopkins Medical Center in Baltimore. He also recently received a Master's of Science from Harvard Medical School for medical education. What I think is his most impressive attribute is that he has 2 awards for excellence in teaching with 2 Golden Apple Awards, which is not easy to get. So without further ado, Mayur Narayan.
Sairam, and good morning to you. Let me start off by thanking Dr. Reddy and the organizational committee, brothers Joe, Hari, Ganesh, and Vijay, for inviting me to give this talk with you this morning. So I'm a trauma surgeon, and the topic is Hands That Serve, a Trauma Surgeon's Journey. Initially, when I chose this field, Mom and Dad weren't really sure about what trauma meant. They were very happy that it had the word Rama in it, and they said, it'll probably be okay. I have no conflicts of interest to disclose. Let me tell you a story. This may not mean anybody to anybody in this room. This is my Tauji and my Taiji, my father's older brother and sister-in-law. He was the director of fisheries in UP. And as it goes, they were traveling from Lucknow, which is the capital of Uttar Pradesh, the state where I was born, to my ancestral home in Bareilly to visit my grandfather. En route, they met with something like this: a small Maruti car, a drunk lorry driver, and they were taken to a small hospital alive. There, the physicians diagnosed them with obvious extremity fractures, missed the internal hemorrhage, and they died 4 hours later. The eye couldn't see what the mind didn't know. This is 2001. This is where I did my training. This is at the same time I was a 4th-year medical student in Norfolk at Eastern Virginia, deciding what I was going to do with my career. And this incident happened, and it clearly made an impact on me as to what I was going to do with my professional career. And so I had an opportunity later that year in 2001 to visit Swami, and in darshan line said, "Swami, I'm thinking about surgery." And as many of us received, a slap on the face that said, "Very happy," and then he moved on. And I took that to say, this is how my journey is going to start. For the youngsters in the room, I put this picture up for a reason. I think it's very important that you choose mentors in your life that are going to guide you, not only within the organization, but in your own specialties where you are. This is Dr. L.D. Britt, who's the chairman of surgery at Norfolk, who took me under his wing as like a father to me, and who has motivated me to do the work that I'm doing in trauma critical care. And he's still one of the master educators in the country. He's done phenomenal work. This is Dr. Wilkes Hubbard, a thoracic surgeon who showed me the art of medicine in terms of bedside manner, sitting with your patients on evening rounds. Still does it to this day. My residents don't like it as much because it takes a lot longer. But his patients loved him. One of the senior surgeons of the Norfolk Surgical Group, and an unbelievable soul. When I left Norfolk, I then went to Baltimore. This is the Shock Trauma Center. It is the busiest trauma center in the country. It sees about 8,500 trauma patients a year. Their motto is, "Where life is on the line," and I'd like to make you remember that for a second. So trauma is a disease, and we are all public health servants, so I would say trauma is a public health disease. It is time-related. Volume matters. It takes time to mature the system. All of these are relatively new concepts within the last 30 or 40 years, and many of them started in Maryland. So if you take a look at this graphic, patients with shock, and how many admissions it takes to make an impact, it takes several hundred before you become a mature system. And if you look at crash mortality as a function of first trauma center designation, you can see the number of years it takes before you start to see an impact in terms of mortality. This is Dr. R. Adams Cowley, for which the Shock Trauma Center is named. Many of you all will know him as the father of the golden hour, which is this following slide. But he was a U.S. Army trauma surgeon. He created the first comprehensive system and really is credited for the first EMS and air ambulance system in the United States. And so there is a golden hour of death between life and death. If you are critically injured, you have less than 60 minutes to survive. The exact time is not that important. But you might not die right then. It may be 3 days or 2 weeks later, but something has happened to your body that is irreparable. That's very true even today. This is the old Shock Trauma Center, which is a 2-bed hospital called the Death Lab. This is where they did experiments to try to save people who were in shock, in traumatic shock. It then went to a 6-bed hospital. And then finally, we can see what happens in terms of survival, in terms of the golden hour. Survival is related to severity and duration. This is the Maryland EMS system, a system that I grew up in, and look at the number of helicopters. This is a very nice slide. It's a very busy slide, but it tells you for a small state like Maryland, we had 8 helicopters. I was giving my first international talk in Kottayam in Kerala, highlighting how awesome this system was. And along the journey of becoming a trauma surgeon, one gentleman stood up in the back, folded his hands and said, "Sir, that's very nice. We don't even have a rickshaw to get the patient down the street." A great lesson to learn that you can't just duplicate the system that you have and take it to a developing country. An important lesson for me as a young trauma surgeon growing up. But if you look at the flight times anywhere within the state, you've got about a half an hour time to the mothership, which is the Shock Trauma Center. And yes, it's fun to recognize the people, the men and women who bring these patients to you. Each day they're sacrificing their lives so that we can have the patients brought in an expedited fashion. And these are some of the men and women that fly our patients. I got a chance to fly with them. I've had some unique experience in the critical care arena as well, molding the journey in trauma and in acute care surgery. Some of you may recognize this face. This is a gentleman who was suicidal. Mental health issues are very problematic in our society. This is a self-inflicted gunshot wound to the face. This is the team with Dr. Ed Rodriguez, who's the chair now of NYU Plastic Surgery Department. When he was with Baltimore, when I was in Baltimore, we worked together. There they did the operative work, and look at the result that they gave Richard Norris. I got to take care of him in the ICU setting, and take a look at this slide. A man who had entire face transplant becomes a GQ model. And this is Richard on a visit after his recovery. You can see that he's doing quite well. Another patient along the journey, Towson football player Gavin Klass, came to me with a temperature of 108 degrees Fahrenheit. You can imagine what that does to the body's function. He was in complete liver failure. He was going to die. This is his parents. You can imagine he's 20-some years old. They were very, very distraught. And we initiated for the first time in Maryland the MARS system. It's the molecular absorbent recycling system. It is basically liver dialysis, bridging him to transplant and bridging him back to the point where he now wants to play football again. I told him I thought it was a horrible idea. I would be a cheerleader on the sideline. But what got him through this is probably what is going to get him through this as well, the football aspect of it. Being in Baltimore, I had the unfortunate scenario of seeing the city under fire. Many of you remember Freddie Gray, the incident when he was brought and he actually died while in police custody. And this is what Baltimore looked like. And it got worse that night. The city was basically on fire, and this is what was going on. I happened to be the trauma surgeon who was on call that night, and you can imagine the anxiety that we were facing. And you have to ask yourself, we had a couple of mindfulness talks yesterday, as to why this would be going on in Baltimore. And as luck would have it, Lifetime was just filming us from the shock trauma side of things, not expecting this to come in, and this is when 10 police officers came in with bricks to their face, and they were injured, and they happened to catch this picture. It was a very distressing night. And this is the media that you saw all over that the city was burning. And we did not feel comfortable until the military came in, National Guard. The city got better. There are still underlying issues, many of which I'm passionate about, including penetrating gun violence in the inner city. Well, I changed focus and I moved to Johns Hopkins, where the motto is, we save lives millions at a time. The world is flat. This is the emergency acute care as a global health priority. I think everybody would recognize this. Haiti, we've talked about yesterday as to the impact that we've made as an organization. Puneet Gail and I were just talking about how it's so hard in residency or in fellowship to go, or if you're working, and that you can give back even though it's not through an organizational branch. Do what you can within your own arena. That's still Seva. And take a look at the pictures. You've seen all this. This is, I thought, was a meaningful slide from me. We were Team 7 from the Shock Trauma Center to go down. We need help. We worked at the St. Francois de Sales Hospital, which is 140 beds, largest private teaching hospital. It was completely collapsed. You take a look at the wards there that you see. It was kind of eerie that the funeral home across the way was standing still where the hospital was in rambles, which is a very bad omen for us. It was very eerie. USAID helped, that's me and my boss rounding. And these are some of the things that we saw. Not so much in the acute phase, but people who came to do good and then left. And you heard people talking about doing Seva when you're going to a country and you're going to stay. It's important to do long-term work, not just short-term work and then leave. You may end up doing more harm than good. This is the shock trauma team that went down. We've done some work in India. The journey continues. I'm passionate about trauma care. It is my life's mission to train pre-hospital providers and to train trauma specialists. I linked up with the All India Institute of Medical Sciences, where I've been a visiting professor for the last 5-6 years. This is Dr. M.C. Mishra, who was a visionary and established the JP Trauma Center, Apex Trauma Center in Delhi, the first of its kind, really pushing the envelope for trauma care. We all see this. This is a common sight. And for my MBA, I did a capstone with EMRI, which is the 108 Management Institute. Got to really get into the trenches to see what this looks like. Important lessons for us. Again, I'm in north of Hyderabad, and I see this diagram or this picture of Dr. Cowley on the wall, crediting him as the father of the golden hour, which I thought was very, very neat. I did not expect to see that in Andhra. And of course, this past year, what an amazing event. 15 years after my aunt and uncle died, we had the World Trauma Congress in New Delhi for the first time. Trauma specialists from around the world, we came together to highlight what's happening in India and also around the world. This is the Indian American Surgical Association I've put together, helped found this organization. We're in our 5th year, try to bridge Indian surgeons who are here and practicing and doing work and Seva projects in India. This is Dr. Ajit Sachdeva. Many of you know him. He is the director of the education wing of the American College of Surgeons. He was given the Lifetime Achievement Award. And that's Preeti John, who's one of my former partners who did a book on women in surgery, which is a unique offering. Swami's taken me to China after the earthquake there to do training in Chinese, although you have translators, but it's been an unbelievable experience for the past 5 years, giving back to them. Love knows no language boundaries. It's been an unbelievable, rewarding experience with the Chinese folks in Chengdu, China. I had an opportunity to go teach the White House Medical Unit trauma training for their medical unit. And this is a complete highlight of my young career as I was starting, unexpected. Of course, I didn't get to meet President Obama. He left, so I got pictures with Sonny and Bo, and so I told my mom again, well, I didn't meet the president, but I have a picture with the dogs, and she said, that's very nice. I'm passionate about trauma because I'm a patient. This is me post-call. I had worked 40 hours, gone home, and then the next thing you know, I fell asleep at the wheel. I'm smiling in this picture, but I wasn't smiling when they rolled me back in, still in scrubs, to the hospital. Trauma hits home, it's personal. And so I'd say the best patient is the one we never see. And I'm committed to injury prevention. Injury prevention includes things such as pre-event, event, and post-event, things related to the agent, the host, and the environment. This is why we call them crashes and not accidents. Because somewhere along the spectrum, we can prevent something from happening. I created the Center for Injury Prevention and Policy in Maryland. One of the first things we worked on is texting and driving. And I want to show you, this is a free video that we created in Maryland. Pole goes through the lady's mouth. You can see the EMS responding. They cut open. This is a video, graphic video, 17 minutes. The helicopter lands. Patient goes to the hospital. We took this to the Motor Vehicle Administration of Maryland, and they made it mandatory viewing for all new drivers in the state of Maryland, which I think is a public policy victory for us, in conjunction with all of the partners that you see there. And so trauma care concepts, as I'm going to summarize here, everybody knows the ABCDEs. What can we do to make a difference? How about always bring compassion during engagement? Those are my ABCDEs. And it's more about the next generation of medical students that are coming down the pipeline. Here's the need. Is there hardening of the heart during medical school? Yes. Students lose empathy for patients during medical school. Does medical school erode student empathy? All concerning things that we're seeing. So what are we going to do about this? This is the taste of chocolate that I like to teach with students. Taste of chocolate being that it's hard to describe what it really tastes like. I play this game with all my students, residents, and fellows. They go down, they give the adjectives. I said, when do you know the taste of chocolate? It's when you put it in your mouth. And then I take any one of the diseases that we're learning about to say, do you have any idea what this tastes like? One of my students just wrote to me early this morning saying she published a blog having put an NG tube in herself for this very reason, to get an appreciation for what her patients are going through. We spend 5 minutes with our patient, and then we're off and running to the races. I think it's a reminder for us to slow down and spend some time with the ones that we're caring about. We created the Humanism Symposium, last 2 or 3 slides here, a full course designated to humanism in practice. This is coming from the medical students. I happen to be the course director. Meaningful course that's still active today at the University of Maryland, something we can do, everybody in this room can do in their own environment in terms of what are the tangible takeaway points. And this is our first guest speaker, Danielle Ofri, for the Humanism Symposium. Finally, the last slide. This is Cornell, where I am now. Stop the bleed. Many of you have heard me talk about this. This is very important. It can happen anywhere in terms of your injury. You've seen this happen in New York, Boston, London. There have been 74 school shootings since Newtown. We must, each one of us, commit to helping learn this simple skills, which are these. Who can respond? Trauma professionals, and immediate responders. But by the time somebody gets there, that person has died. Apply pressure, apply dressing with gauze, and apply a tourniquet. That's it. Anybody can learn this. I urge each one of you to please learn this skill. It takes about 40 minutes to learn. You become certified, a tangible takeaway point. We're doing this for 300 businesses in New York. This is going to be our community outreach project. I want to thank you for the opportunity of the podium. It's been a pleasure. This has been an awesome conference, and I look forward to interacting with you all in the future. A loving Sayram.